So without further ado, I'd like to introduce Dr. Claire Coles, who is a professor of psychiatry and behavioral sciences at Emory School of Medicine in Atlanta, Georgia. She's director of the Center for Maternal Substance Abuse and Child Development, which includes Mother to Baby Georgia, a teratology information service providing counseling and information to pregnant and breastfeeding women, their partners, and healthcare professionals about exposure to prescription and illicit drugs and a variety of environmental toxins, as well as an Emory Neurobehavior and Exposure Clinic, the only clinic in the Southeast specializing in the care of children exposed to alcohol and drugs and their families. Dr. Cole's research on the developmental and behavioral effects of prenatal exposure to alcohol and drugs and the interaction of these effects with the postnatal environment began in 1980 and was among one of the first to describe many behavioral effects of prenatal alcohol exposure in infants, young children, and adolescents, as well as the effects on brain structure and function in young adults. Currently, Dr. Coles is principal investigator in a multi-site long-term study of adverse effects prenatal alcohol exposure on adult health and middle age, and a co-investigator on a prospective study of FASD in the Ukraine.
So this is a talk about long-term effects of prenatal alcohol exposure. Alcohol-affected adults self-report on their health and mental health status. And this is evidence from two different sites here in Atlanta and in Seattle. Okay, I want to acknowledge everybody in the world. This research, this data comes from a study that is part of CFAS, the Collaborative Initiative on Fetal Alcohol Spectrum Disorders, which is supported by the National Institute on Alcoholism and Alcohol Abuse. However, our initial research was supported by the Georgia Department of Behavioral Health and Developmental Disabilities. And there is also funding coming to the Seattle site from the University of Washington and Strathgood Endowed Professorship. And finally, we received funding for our work from the SKK Foundation through a gift to our center. There are a number of people who have collaborated in this work, and it's still ongoing, so they're still collaborating. This is through the Department of Psychiatry and Behavioral Sciences at Emory, and we have several people, Julie Cable, Alex Perez, Mary Ellen Lynch are co-investigators, and then a number of people who are providing support from us. In addition, we have the people in the Department of Psychiatry and Behavioral Sciences at the Drug and Alcohol Unit at University of Washington with Therese Grant, who is the site PI, Catherine Kelly, Sandra Radin, and Susan Stoner. And Tim, I believe, is doing all the work. The outreach. Finally, we are collaborating as part of this with Joanne Weinberg and University of British Columbia, which is another aspect of what we're doing, with Ken Jones, who everybody who knows anything about FAS knows, with Michael Suti at the University of Oxford, and with Ed Riley at San Diego State. So this is CFAS. It's this great, huge octopus of people. The problem that we're trying to investigate. We know from recent studies that FASD, or fetal alcohol spectrum disorders, are fairly prevalent, and that can be identified really across the board in a number, even in people who don't necessarily exhibit all the effects. But there's almost no research that's been carried out over the lifespan. So I was originally a developmental psychologist, and developmental psychologists always want to look at the lifespan because they think that's the best thing to do. But we really don't know much about adult health, adult characteristics, anything else that goes on with adults in this group of people. And there's a whole hypothesis, which you're probably aware of, called the Developmental Origins of Health and Disease hypothesis, which has received a lot of research over the last 20, 30 years. And what has been found with that particular way of looking at things is that early insults happening prenatally and even postnatally have long-term effects or perhaps cumulative effects on the individual as they get older. So that, for instance, lack of adequate nutrition in pregnancy, for instance, resulting in low birth weight, is associated with later cardiac problems, and later incidence of diabetes and a number of other things. It occurred to us that this ought to be involved with alcohol exposure. And we expected that we would begin to see these long-term effects in at least middle adulthood. And this is, again, a graphic of the fetal programming hypothesis, that early life events can program the body and brain systems, and they may alter the developmental trajectory and increasing vulnerability to disease and mental health issues later in life. And so this is a way of looking at it. And we see increased risk for metabolic disorders, cardiovascular disease, immune dysfunction, mental health disorders. And mental health disorders may take a number of different forms, which I will discuss. So that's the background of what we're talking about. The study is this. It's a multi-site collaborative study. And the sites include Atlanta, Georgia, Seattle, Washington, and then there's a parallel study that's going on in Vancouver, British Columbia. And there are 2 tiers of assessment, and I'm only going to talk to you today about tier 1. The 2 tiers are on a demographic and health survey and a registry for people who are willing to participate in future research, and in which people are simply responding to questionnaires. And then there's a in-depth assessment in tier 2, in which we're bringing people back to our laboratory and doing a much more comprehensive physical and cognitive assessment. We're also drawing blood to look at immune function and so on in that group. And I'm not going to report on that because that's still an ongoing process. It's very important to understand who the participant pool is for this study. One of the things we wanted to be sure of when we began the study was that we were dealing with people who were genuinely prenatally exposed to alcohol. And as you might imagine, asking somebody after 40 years whether they've been prenatally exposed to alcohol is a fool's errand, basically, because the average person has little understanding of that. But we were able to go to Seattle and Atlanta, where there were longitudinal cohorts of individuals who have been followed for over most of their life. And in Seattle, we have a total of 475 individuals now between 25 and 69 years, predominantly Caucasian and Indigenous. And about 37% of those people were seen early in life and met criteria for fetal alcohol spectrum disorders. And a number of others were non-dysmorphic, but had evidence of effects of alcohol exposure. In Atlanta, we have a similar cohort who are now in their late 30s. And these are predominantly African-American individuals, predominantly low socioeconomic status. And these people were recruited prenatally from the same inner city hospital for both those who were alcohol exposed and those who were not exposed. In Vancouver, they're collecting people who have a diagnosis of FAS in adulthood. And eventually we're going to compare the results for all these different methodologies and see what we get. I'm going to talk today about those people from Seattle and Atlanta. And let me tell you about our Tier 1 health survey. This is an adult health survey. We were aiming for 500 people. We, at the moment, actually have about 320. I'm going to report to you on 292 that we had when I had a chance to do the data analysis. And the survey is about chronic medical problems in midlife and access to healthcare. We developed the questionnaire based on the CDC's Behavioral Risk Factor Surveillance System questionnaire, which is publicly available, and you can look it up if you wish anytime. It's an interesting study, which actually, as I was preparing this, and I'd already done it, I got called to be interviewed by the CDC with this questionnaire, and it was very interesting. Somebody came to my house and interviewed me. I didn't tell them what I was doing. But there's a different health risk surveillance system questionnaire for different years, and they have different modules in them. And the CDC has all this background data, which we'll eventually be able to compare our samples to. So we selected those existing modules from what had been done over the years that we wanted to put in our survey. And then we added some modules on things which they had never looked at, like neurology, vision, hearing, and so on. And we created modules on gastrointestinal issues and immunology as well. And the issues assessed are listed here: access to healthcare, sleep, vision, hearing, and dental care, allergies, asthma, cardiovascular events, GI issues, diabetes, autoimmune disorders, arthritis, seizures, depression, anxiety, other medical problems, and adverse childhood experiences. The CDC includes in its questionnaire questions on adverse childhood experiences, which, and this is like in the last 2 or 3 years become very prominent. When we were doing it, we just thought, well, that ought to be important. So we included it. This health survey can be administered in several ways, and we have done all of them. You can do it in person. You can do it by phone. We can also send one to you on the email, and you can do it either on your computer or on your phone. We wanted to make it as easy as possible for people to answer the questions. As COVID arose, it became real evident that email was a wonderful methodology for doing this, or by phone, since we really weren't being able to interact with people in person. Here are the characteristics of the sample of 292 people that we have seen to the point where I began analyzing these data. As you will see, there's no difference in the age of individuals, and this is broken up into a contrast group of people who were not exposed to alcohol. Then there's an alcohol exposed group, and these are the people who are mother used alcohol, but also who had mild issues but don't rise to the level of meeting criteria for FAS. And finally, we have a group of people who are in fact either full syndrome or have very significant developmental problems, physical problems associated. So we have different groups of people. And as you can see, there's no difference in age. The majority of people who participated in the study are female at this point in time, because really those are the people who cooperate with you when you go back after 40 years. And I cannot really explain in a brief period of time how miserably difficult it is to find people 40 years after the fact. This is not a trivial phenomenon. The other thing I want to point out is that we really have a very diverse group of people here, with maybe about 40% being Caucasian, around 40% or so being African American, a significant percentage being Native American, and then others, particularly people who describe themselves as being of mixed race. We also were able to calculate the Hollingshead rankings for these people. And if you want me to explain that in greater depth, I don't know, but I will. But I would like to emphasize that even though the control group is now a higher rank than are the alcohol exposed group, when they started life, these people were all the same rank. So it isn't a question of us selecting people who were of a different social class. These people are all the same social class. Because of the nature of the disorder we're dealing with, the people in the alcohol exposed groups have not been able to achieve this much academically and in terms of vocational choices. The other thing that's very interesting, I think, and probably speaks to response to stress, is that those people who are alcohol affected are much less likely to be married than are the people in the contrast group, control group. And that has a lot to do with their social functioning, of course. However, they have equal numbers of biological children. And not surprisingly, those people in the contrast group, the control group, have much higher household incomes than do those in the alcohol groups. So in summary, alcohol-affected individuals are less often married, have lower SES and lower incomes than the contrast group. We also asked if they had health insurance, and we found equal numbers had health insurance, but they had different types of health insurance. The controls are much more likely to have private insurance, whereas the alcohol groups are more likely to have Medicaid. We asked if they considered themselves to be in good health. And again, those people in the control group were more likely to consider themselves in good health than were either of the other two groups. And that was particularly true of mental health rather than physical health. So I'm now going to go through a whole different lot of categories of health and show you what people said. The questionnaire is formatted this way. Do you have a problem with something, or has a doctor diagnosed you as having a such and such disorder? And as you can see, everybody wears glasses. However, those individuals in the alcohol group are more likely to report hearing problems, and they're much more likely to report dental problems. I would like to bring to your attention that having Medicaid does not give you dental services. So many people in these populations will have significant dental problems. Cardiovascular was interesting. We asked if you had a heart problem as a child. And again, we have most people said no. There looks like a slightly higher range with FAS, but we're not there. They have a trend to having heart problems now, and none of them acknowledge having high blood pressure. We did, however, test some of these people in the lab rather than just asking them. And when we actually took their blood pressure, they had higher blood pressure if they're alcohol exposed. So this is one of those, they don't really know they have high blood pressure questions. A lot of people don't know if they have high blood pressure. Gastrointestinal issues. When we asked about stomach problems, heartburn, bowel problems, we found that in both cases, alcohol-affected individuals reported having more problems with GI, gastrointestinal issues. When we ask about kidney and urinary issues, and again, I don't know that I expected this, many more people in the alcohol group had kidney stones, bladder infections, and reported incontinence. We ask about endocrine problems. Are you pre-diabetic and diabetic? Those are just inching up in the direction of, remember, these people are in their late 30s. However, there are many more people who report thyroid disorder. Another question was, has a medical professor diagnosed you as having allergies, skin problems, autoimmune diseases? We're interested in allergies, not autoimmune. More individuals with alcohol exposure reported allergies. They reported more skin problems, rashes, and things of that sort, eczema. And they did not report more autoimmune disorders. Although we're sort of interested in that. And as I said, we have drawn bloods, which are going to be analyzed in British Columbia to see what really is going on with the autoimmune situation. Interestingly, when we broke down the kinds of things associated with autoimmune disorders into arthritis, rheumatoid arthritis, gout, lupus, fibromyalgia, we found that individuals with alcohol exposure did in fact report more arthritis. And again, 38 years old here. We're not talking about 68-year-old people. Another striking thing to us was the question about cancer. 10 of the alcohol-affected individuals reported having cancer, whereas only 1 of the controls did. And the women reported having breast cancer, cervical cancer, and a number of people had reported skin cancer. So there were much higher incidence of cancer in this group. We calculated the relative risk of cancer in the alcohol group, and it is 5.2. In terms of mental health, well, I guess seizure is sort of physical in between. Has a medical professional diagnosed a seizure disorder? Again, those individuals who are alcohol exposed reported a higher incidence of seizure disorders. And then we were I was because I'm a psychologist, particularly interested in mental health issues. And also there has been report of a higher rate of mental health issues among alcohol exposed individuals. So we looked at ADHD, which is widely reported in children who are alcohol affected, depression, bipolar disorder, anxiety, and incidence of psychosis. There are a number of reports of higher level of psychosis in this group, which I suspect are artifacts of the way in which the data is collected. And we found that with the exception of psychosis, the alcohol groups have significantly higher rates of diagnosed mental health disorders. So this is, I found sort of overwhelming when I first looked at these data. And the question that, of course, comes to mind, because this is self-reported data and it's just frequencies. How can we understand these outcomes? Is it that prenatal alcohol exposure is a direct cause of negative health and mental health outcomes? Is prenatal exposure associated with them? And other things are leading to it? And is prenatal alcohol exposure one of many factors affecting outcomes? What is the relationship between alcohol exposure and health and mental health outcomes? Now, there's previous research which suggests, previous research with everything, I would say, that multiple factors are associated with any outcome that you see in midlife. And that we conceptualize this in terms of stress. And there are a number of different stressors that are playing themselves out in this group of individuals. Certainly, social class, race, ethnicity, access to healthcare, in addition to maternal substance use, postnatal environmental issues, life experience, as well as individual characteristics like sex or gender and ability. And all of those things are going to impact one's presentation in terms of health in midlife. So how do we look at this? Well, one of the things that we did measure that we felt might be very likely be important was adverse childhood experiences, or what's called ACEs. According to the CDC, ACEs are potentially traumatic events that occur in childhood. And they are linked to chronic health problems, mental illness, and to substance abuse problems in adulthood. So there's quite clear evidence that there's a relationship. About 61% of all adults surveyed by the CDC report at least one ACEs. And I imagine if all of you consult your own childhood, you'll find one or two floating around. For instance, one of the ACEs is having a parent die, and my mother died when I was a child, so I right away get a big red flag for that. Fortunately, I didn't have any of the others, but many of the people we're dealing with have multiple such events that have occurred. And research suggests that reporting 4 ACEs or more is associated with an increase in negative outcomes. And that's an article by Merrick et al. That comes from the MLR, I forgot how, the CDC publication. 16% of adults reported 4 or more ACEs in the CDC survey. This is the adverse childhood experiences reported in our sample of 292 individuals. And you'll note that I've marked where 4 is on the chart. The controls are all beneath that level. And the women, particularly in the alcohol groups, are all above that level. And we've just got really high scores on differentiating these groups, that alcohol and sex are both highly significant. Over on the other side of the screen, you'll see the specific items in which the individuals with alcohol exposure had higher scores. The only ones in which they didn't report more of a problem was having the parent die and domestic violence, which is inter-partner violence. On every other of 11 different items listed in the CDC questionnaire, they reported higher levels of trauma, essentially. And that's pretty powerful data, actually, in terms of what is going on with this group of people. And I don't think we can ignore this in terms of what that means for their later health. And then again, remember, we have health insurance. And health insurance I'm using here as a proxy for social resources. So I did some regression models looking at multiple influences on medical diagnosis. Here we have cancer and diabetes. And if you look at the different factors, I put in prenatal alcohol exposure, sex, SES, ACEs, and health insurance. Sex is, in fact, gender, and I know the difference. And sex happened to be the variable that was in the computer, however. And by the way, in this sample, there was only one person who expressed a different gender from that which they were born with. But as you'll see, that for cancer diagnosis, there are two factors that come out as significant. One is prenatal alcohol exposure, the other is ACEs. When we look at diabetes, what we get is prenatal alcohol exposure, gender, and social class. All of those things can be thought of. I mean, obviously, the adverse childhood experiences and social status are both stressors. And so increasingly, I think of what we're looking at here as an additive stress on the individual as they age, resulting in a higher risk for disease. Here are some others: thyroid disorder, kidney stones. Thyroid disorder is highly related to prenatal alcohol exposure, interestingly, as is gender, and again, ACEs. Kidneys, the only thing we get is prenatal alcohol exposure. Now that raises another question. Do different outcomes have different precursors, which is, I'm imagining is the case. So I decided that still the regression model wasn't good enough because I really wasn't sure whether or not the prenatal alcohol exposure was a direct effect or a mediated effect, whether or not it was something that passed through another variable in order to have an outcome. So we did some path analyses. Path analysis is a method that's used to discern and assess effects of a set of variables on a particular outcome via multiple pathways. It's sometimes called causal modeling, but it's important to remember that this is all regression, and therefore cause is an assumption, not something we can actually say is true. We estimate the path coefficients from the correlations and the degree of relationship. And when we come up with models, they can be correlated, mediated, or independent. And you can break up the correlations into a direct effect from, say, FAS, from prenatal alcohol exposure to an outcome, or an indirect effect when you have an intermediate variable, or things can be error variance, essentially. So I decided to use an example. I'm going to do two examples. One is depression symptoms. In addition to asking whether you'd been depressed, whether you'd been diagnosed with depression, we also ask to report on specific symptoms. And here are symptoms of depression that are potentially included. And when we do the path analysis for symptoms of depression, we get this, which is exciting. And and we included as variables: age of the individual, sex at birth, alcohol exposed, yes or no, site, Hollingshead rank, the adverse childhood experiences, body mass index, dysmorphia, and that is the degree, that is whether or not the person had physical, facial, and growth features associated with alcohol exposure and depressive symptoms. And this is a path analysis showing only the significant relationships for number of depressive symptoms. And if you will note that the PAE, which is highly related to when we just do a yes, no, and a chi-square, we find that it is not directly related, it is indirectly related, and it goes through other factors. Specifically, depression is here predicted by social class, sex, and ACEs, and PAE is related, of course, to SES and ACEs. So you have a situation in which the alcohol exposure is mediated between the childhood experiences and the current life situation in terms of social class. So how do we interpret such relationships? Well, in the box is a very jargony discussion of what the relationship of an indirect mediated effect on alcohol is. But essentially what it means is as alcohol goes up by 1 standard deviation, the probability of depression goes up by 0.118. This is a significant relationship, quite significant, but it is in fact obvious that depression has many factors which lead to that result, and that alcohol is only one of them. And again, it's indirect relationship. And again, what does this tell us about prenatal alcohol exposure and depression in adulthood? Adults with a history of prenatal exposure are more likely to report symptoms of depression if they also report adverse childhood experiences, have other stressful life experiences, that is, are low SES, or come from a socially disadvantaged group, and are female. Who, by the way, despite the fact that we're mostly female here, is a socially disadvantaged group as well. So the more stress the individual has experienced, the more likely they are to report depression, which is not, I don't think, news to anyone. Another question was, there was a highly significant effect on endorsement of thyroid disorder. It looked like this. So what does that path analysis look like? Is there a direct or indirect effect of prenatal alcohol exposure? And this is this path analysis. And here we find that, again, it's an indirect effect. And the standardized indirect effect is 0.21. So as alcohol goes up 1 standard deviation, the probability of having a thyroid disorder goes up 0.121. Again, highly significant, but again, it is not the only basis for this. And so this is the cleaned up version of that. Thyroid is again predicted by sex, ACEs, and indirectly by alcohol. So what are the implications of these kinds of findings? So we see here that alcohol exposure has a relationship or a long-term association with a whole bunch of medical problems. That suggests that when we know that somebody is alcohol exposed, like for instance, if they have FAS or FAE, which isn't a thing we say anymore, FASD, their medical provider should be screening for problems across the board. So that alcohol exposed adults should have regular medical checkups, and medical providers should be made aware of the likelihood that these individuals will have a higher risk for long-term health problems. Another question that has arisen through all of this is, are we looking at some kind of premature aging factor? Is, for instance, the prenatal exposure and the producing a earlier onset of some of the diseases that are associated with aging? And that's something that we will have to follow these individuals longer to get a better handle on. And another, of course, important point is that mental health problems are more common in alcohol-affected individuals, and they should also be screened for in this group. A second thing that's an important implication is, how do we prevent these things from occurring? Because clearly what we're talking about is a mediated effect. There is a direct effect on some of these outcomes. This could obviously have been prevented if the pregnancy was not alcohol exposed. But once it has happened, it is important that if we know about these negative physical and mental outcomes, that we could begin earlier to provide appropriate health care for individuals in order to prevent them becoming ill or mentally ill. And some of the associated factors like adverse childhood experiences are apparently more toxic for this group than for others, as toxic as they are for everybody. And therefore, we need to be particularly careful in dealing with individuals we know to be prenatally exposed to try to intervene to prevent their exposure to a greater stress than they're able to cope with effectively. So when a child is known to be exposed, we should be attending to these associated factors, these stressors, and trying to find ways to help them cope or provide them with coping mechanisms that are more effective than has occurred to this point in time. There are also some implications for what we might consider further research. These are very preliminary results. We have some other results. For instance, Dr. Cable, my colleague, has looked at a subsample of these individuals and looked at vascularization, cardiovascular functioning, and insulin, and so on, and finds alterations in the way insulin is processed. So we're beginning to be able to unwrap some of these things. But clearly, both the medical and mental health associations with these consequences that are associated with this exposure need a lot more research. So we need to be able not only to describe these outcomes, which is a very cursory way of looking at it, but really come to understand how it's working and what's going on. And then again, the group of people we're working with here are still relatively young. And even so, we found all these effects. I think I would expect them to be exacerbated over time, and that we might anticipate that as they grow older, we're going to see more issues arise, and perhaps at earlier ages than would typically be expected. And this is, I think, an area for future research.